Now, what exactly is a Morton's neuroma? So a Morton's neuroma is a disorder or a problem in the nerve that sits in between. I'll use my foot model to help explain this. So right in between these long bones, these bones are called the metatarsals. So there's a nerve that sits right in between there, and when it gets to the bases of the toes, it branches out to the toes. Now, in that particular spot, there's a good-sized nerve there. And what happens is that if we're wearing tight shoes over time, or our foot structure changes, which it does do, it changes as we age, that you can add some pressure on that particular nerve, or on that what's called the neuroma. So a neuroma is a pinched nerve or thickening of the nerve fibers that is very painful. And just as that question describes, it's a burning sensation. It's between two particular toes. And it's very common to see it between the third and fourth metatarsals that are affecting the third and fourth toe. And injection therapy works occasionally. That's something that we typically would start with is injection therapy, maybe some medications to help control some of the burning pain that they have. But in essence, if that fails, the next option would be surgical intervention. And we make a small incision on the top of the foot. We go in and we find that particular nerve, and we actually release it. We take that nerve out of there, and it's most of the time that we see that. In fact, a lot of the times we see that, you can physically see the deformity of the nerve because it's so thick, and it's not supposed to be like that. But obviously, the diagnosis is truly made through pathology. We sent that to pathologists to identify under a microscope. But that majority of the time will alleviate that burning pain in those toes. Now, the downside to that is you have numbness between those two toes, partial numbness, which is still comfortable. Even after? Okay. Yeah, we'd rather have numbness than burning pain. And people are willing to change that because anytime you take out a nerve, you're going to be dealing with some numbness. Yeah. And that particular procedure is one of those. But it's great. People love that procedure. There's not a lot of downtime. I actually let them walk on their foot after a few weeks, and they do quite well with that procedure. Okay. So I would call that a Morton's neuroma, the way that question was describing the pathology and the symptoms that they're having.
Okay.